Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. I just took my mask off. Of course, it's a personal decision on your part, but I try to keep everybody safe around me and myself safe. The topic of this program is genomics and how it's transforming healthcare. And we have three experts from Nicklaus Children's Hospital. And their subject matter is personalized and genomic medicine. So let me first introduce Evelyn María Dean-Olmsted, and she's a Ph.D. So Dr. Olmsted, Dean-Olmsted, how are you?
I'm fine, thank you so much. Very nice to be here.
To see you. And then we have Paula Espinal, Dr. Paula Espinal, and also a Master's of Public Health. Welcome. Nice to see you.
Hi, nice to be here.
And Anuj Jayakar, Doctor, M.D. Good to see you, sir.
It's a pleasure to be here. Thanks for having me.
So why don't we talk about the main topic, which is genomics and how it's transforming healthcare. And let me tell you why we wanted to do this show. You know, we do the show based upon the viewers asking us questions. And we've been doing it for 22 years, so somehow we're answering their questions. And there's a lot of interest in genomics and the whole issue of gene structure. Obviously, the pandemic has led people to know what DNA and RNA, at least the words or the acronyms relate to. But we have a lot of interest in what genomics is doing relative to, in quotes, transforming healthcare. So who's up first?
I can tap in if you like, Evie. Hi, I'm Dr. Espinal. I'm a physician and epidemiologist by training. I am the principal investigator of Nicklaus Children's Biobank and the manager of the Personalized Medicine Research Program. So what does personalized medicine even mean? So personalized medicine, precision medicine, as some people know it, is the new face of medicine. Basically, it takes into account people's genetic makeup to tailor the medical care, meaning finding the best diagnostic tools, treatment, and even preventive care based on your DNA. We can argue that this new phase of medicine started with the Human Genome Project. This project aimed to identify, map, and sequence the complete human genome. The Human Genome Project then opened the floodgates to a deeper understanding of medicine as how we see it now. That's why you hear terms like next generation sequencing, whole exome sequencing, which all these terms means is to refer to a laboratory method test that we use to determine the entire genetic makeup of a specific organism or cell type. For example, through history, we doctors have prescribed medications for patients based on specific conditions, but some patients didn't respond as well as others to those medications, and we didn't know why. Now, through our discovery of the genome and the DNA, we understand that your genes have some kind of impact in how you respond to treatment. And now there's a whole new area of study to study this, and it's called pharmacogenomics. Furthermore, here at Nicklaus, we understand that kids are not small adults, and that's why we needed to provide personalized and unique treatment to our patients. That's why we decided to bring this new phase of medicine, of personalized medicine, to our community. This project brought to us back in 2018, thanks to the vision of Dr. McCafferty, Melnick, and Saljakina, and to the support of Sanford Health Foundation and Jack Nicklaus family. Through these efforts, we have developed our own very own biobank with more than 600 participants and growing. And we're currently studying the very onset of inflammatory bowel disease and COVID-19 multi-inflammatory syndrome in children. Our program seeks to also shorten the gap in the current genomic medicine, where most of the samples came through Northern European backgrounds. Our Biobank and our personalized medicine program is helping us gain an understanding of South Florida community genomics diversity so we can learn more about our health and tailor personalized medicine care for each individual in our community. We currently offer personalized medicine efforts to cancer patients and provide whole genome sequencing testing to critical ill patients. But I'm going to let my colleague, Dr. Anuj Jayakar, kind of tap in here and help us how this project has been impacting our clinical care and our patients.
Dr. Jayakar?
Thank you, Paula. So my name is Dr. Anuj Jayakar. I'm the Director of Neurocritical Care here at Nicklaus Children's. I'm a child neurologist and a member of our neurology department and division of epilepsy here. I've had the privilege of working with our genetics and research teams here at Nicklaus Children's since I've started here to help work and implement this personalized medicine project, and have really been very excited to see how we can really direct it towards patient care. I think Dr. Espinal mentioned that genetics has come a long way over the last 20 years. We are now realizing more and more that no two children are the same, and even children who have similar genetic conditions or similar presentations may have very different genes, and that really impacts how we treat them. And we, over the last 5 years, we've been really proactive here at Nicklaus Children's to use more cutting edge technology in order to, one, give more accurate diagnoses for these kids, as well as to give more timely diagnoses of these kids. And that's really been key to helping us change our management in a variety of different ways. We've been implementing a lot of these kind of broader sequencing tools, such as genome sequencing, in two different ways. One has been through our outpatient sector in collaboration with an institute called Illumina, where we've been able to help patients through a project called the Odyssey, where we've been helping patients with complex genetic or kind of complex pediatric conditions. I, as a neurologist, like to say they're neurologic conditions, but realistically, it's a full spectrum involving multiple different organs within the body. And what we've been doing is utilizing this genome sequencing in order to try and help families get an answer. Many families with children with chronic and complicated diseases will go for years and years doing multiple tests and not able to get a clear answer for what is the cause for their children's condition. So through projects like the Odyssey, we've been able to get diagnoses for these kids and in ways that we were never able to do before. We've also implemented the same genomic sequencing for our inpatient population as well, specifically those children who are critically ill within our intensive care units. We've been working with the Sanford Consortium and Rady Children's to do a project called our rapid whole genome sequencing, in which we do the same genome sequencing, but as the name implies, in a more timely manner. And this is very important, as you would expect for these critically ill children, because these are the kids where having a diagnosis quickly really, really impacts their care and impacts how we treat these kids in quite a dramatic way.
I have a very good question for you, but I'm going to let Dr. Evelyn, María, Dean have a few words, and then going to come back to you because I have a question for you. Dr. Dean-Olmsted?
Hi, thank you so much. It's so exciting to be a part of this team. I think one thing that, my name is Evelyn Dean-Olmsted, and I am the manager of health outcomes research within our department. I'm in the same department as Dr. Espinal, within our Department of Personalized Medicine and Health Outcomes. So I oversee some of the research that looks into the social and psychological aspects, as well as the medical outcomes of these programs and other programs in our hospital. And it's very exciting for me as an anthropologist, a social scientist, to be in a team like this. It's very unique in that we're very interdisciplinary. So you see, we have MDs, we have Dr. Espinal with her background in epidemiology, we have scientists and psychologists from different backgrounds. So this really makes our program stand out, and that not only do we work with our clinical team to bring these cutting edge research benefits immediately to the patients or as quickly as possible, But then we also have this component that sort of looks at the social aspect, the psychological impacts of genetic testing, which can be substantial. And then finally, we have an outreach component as well. So I want to talk first about the sort of social and psychological impacts. I've been fortunate to be a part of a project that looks specifically at this aspect, because the implications of a genetic diagnosis are so wide-reaching. It can have implications for the parents' health, for other family members' health, for future family planning. So even in addition to the general stress of having a child in a critical care environment or a chronically ill child, there is this additional stress about a potential genetic diagnosis. So the project that I'm a part of now has done hundreds of interviews with parents and caregivers of children who undergo whole genome sequencing, looking at what are their needs, what are their concerns. And what we really identified is that most of them, regardless of whether it's a positive or negative diagnosis, are very happy to have the testing because it does provide a lot of answers.
We've been doing this for 22 years, and really what we do is we get questions from our viewers. And the reason why we have so many questions about genomics, or genes, is because of this insidious pandemic. And all of a sudden now, as part of the discussion, whether it be, in X or Y or Z standards of living, you got people that all of a sudden now are saying RNA, DNA, etc., and they're starting to understand that there is a value to understanding the science of this particular pandemic. I've always wondered why we were not willing to spend more time looking at that to prevent disease or to treat disease. And yet this pandemic has allowed people to say, oh, we can do that. So who's going to jump in? Dr. Jayakar?
Yeah, I'm happy to. I think so. This is kind of, I would approach this on two fronts. So I think in terms of kind of what we've learned of genetics, we had kind of a period of time where we had learned a lot decades ago. There was a period of time where we didn't make much progress. Then over the last, I would say 20 years, we've been making sizable leaps. But that being said, there's still a lot of it that we don't fully understand. And that's because there's different building blocks in terms of how we get from DNA to who we are as a human being. And that includes DNA, the RNA, which then kind of encodes it and builds the proteins, the protein structure, how those proteins are then put together to make the cells, and then everything from there. And then how our metabolism and our biochemistry works to function. I think we've been, over the last, I would say 10 years, there's been a sizable amount of work in the field of translational kind of neuroscience and science, where we've been trying to go from the bench in the laboratory, in the lab, to the clinical setting. And I think this is really, really where we've been able to understand how the DNA really causes some of the diseases that we see in our kind of day-to-day life.
Do you also see, and either one of you can jump in, do you also see the change in the delivery of healthcare, where there's far more collaboration? Just look at the three of you coming together, maybe in the same field or adjunct fields, and now instead of just making your own decision or trying to sell your own knowledge, you're doing it together. Don't you see the changes in healthcare that are dramatic? I think they are so dramatic.
I couldn't agree more.
Okay. Dr. Espinal, what do you think?
Yeah, I think you brought a good point, especially during the times of COVID. I think genomics opened the door as well for us to understand viruses a little bit better. And people now hear, oh, there's a new variant, there's something else new with COVID. And it's because now through this technology of us understanding the DNA even better and open the book and understanding inside the books, there's chapters. Inside the chapters, there's paragraph. And inside this paragraph, this specific coding creates a different kind of disease or specific characteristics for a virus. And I think those are the benefits that we see with this new technology of whole genome sequencing, next generation sequencing. And it came across now during the times of COVID that we quickly were able to provide the sequence of and sequence the virus itself and kind of understand it in a deeper level, which help us create targeted vaccines, help us define better treatments, help us define better diagnostic tools quicker than we did in the past for other sickness, right? I feel that you're trying, maybe, let me see if I explain myself, that the collaborative efforts, it has to be worldwide, that you are here and that a lot of these projects are done outside the US and the US might not be painting a picture and in the communications, but the reality is these are interdisciplinary efforts. They work with different countries. Even with COVID-19, the data was shared between countries, samples were shared between countries. And this is actually also thanks to the help of biobanks. Through the work of biobanks here in the US, in Europe, in Africa, in Israel, in Latin America, we were able to collect samples as well as data from different parts of the world and kind of understand how the virus was acting out in different areas, different phenotypes, different genotypes, and kind of understand it a little bit better. Here in the US, back in 2015, we had an initiative called Precision Medicine Initiative that the government put out there to kind of put some spotlight on what precision medicine is and what they're doing. We also have a personalized medicine initiative program with National Health Institute, the National Institute of Health, which I feel like is doing great work. I do agree with you. If we had more funding, research for sure will be in the forefront of everything that we're doing in healthcare. So if I needed to maybe call out more help and provide to say that we need more funding for more research, that is definitely the case. We need for our research efforts here in the US to have a better spotlight and for us to do more collaborative work with other countries and kind of learn together about this new phase of medicine.
One of our viewers, and Dr. Dean-Olmsted, you'll be next. One of our viewers asked a question. I said, well, you know, if we have all this information around the world, why are we not sharing it? Why is there not an element of the United Nations that deals with that? Now, I don't know. Is there an element of the United Nations that deals with genomic medicine or items such as that? Does anyone have the answer?
Yes and no. The problem with this is regulations in every country is different. There's ethical barriers that also are playing into account in every country, laws that are important to follow, and clinical practices, and also tools available in every country, right? There are few organizations for biobanking and for big data where you pull and you share data between countries and between institutions and between agreements through de-identified data sharing, because we always need to protect the identity of participants, right? In this kind of studies, then you can do collaboration. But those kind of collaborations are tricky because first you need to make sure that every participant in the collaboration is following regulatory guidelines, is following data integrity, is following the same data collection type. Those are not always miss and match, you know, like apples and oranges, right? Sometimes having these collaborative efforts do take a little bit of while to put together for sharing.
Dr. Dean-Olmsted, what do you have to say about this?
Well, I appreciate that you brought up that COVID has really put genomics on everybody's radar and into people's lexicon. An important part of personalized medicine is the fact that it's not sort of restricted to one area or one department, right? It's not like, oh, there's genetics and then there's everything else. Genomics is now, because of these advances in technology, part of every branch of medicine, part of everyday treatment, and it's going to be more and more the case. So it is, at the same time, research has shown that literacy, health literacy, especially regarding genetics and genomics, is really low in the general population. So it's really critical that people have an understanding of what it means, some of these basic terms, what are the possibilities, what are the limitations, what are the ethical implications of this kind of personalized medicine and of genomics. And so that's where our kind of public outreach work comes in. I want to mention two things. One is the Victor Center for the Prevention of Jewish Genetic Diseases, which is underneath our program. It's led by Deborah Wasserman, who's the outreach coordinator and the genetic counselor. And they have been working for years, like you said, about prevention of rare genetic diseases. Although they started out focusing on diseases more common in Ashkenazi Jewish populations, we've expanded. We now have a pan-ethnic panel where couples who are thinking of conceiving, or young people in general, can screen for some of the most common genetic conditions and then prevent these conditions from manifesting in their future children. And they have helped us put together this event called Genuary, which is what we're doing right now. And it's a month-long series of events and lectures on genomic medicine, especially that we're doing here at Nicklaus Children's. And that's part of our outreach mission, to educate the general public about all this research. And I'd like to mention one more project that we're doing, and Dr. Espinal and I have been working on this for a long time, and we're very proud of it. It's called Project Genes. That stands for Genomic Education, Nurturing, Empowering, and Sustainable. And it is an after-school science program that we've developed in partnership with Overtown Youth Center, with support from a gift from the Miami Dolphins Foundation. And it's an 8-week after-school program that delivers critical information to children, especially in Black and Brown and underserved communities, because there is a particular need for good education and also trustworthy relationships built between medicine and research and communities that have been either excluded or outright exploited by research in the past. So this is something we're very excited about. Yeah.
Let me, I don't mean to step on your words, but let me end. The three of you, are you, who has the longest tenure at Nicklaus Children's Hospital?
I think it would be Paula. Yeah, Dr. Espinal.
I think it's Anuj.
No, I've been here for 5 years, but I technically have grown up too. So
The reason I ask is because I go back to South Florida many years, decades ago, and we always used to ship, in quotes, our difficult medical cases, or people chose to go to New York or Massachusetts or Texas or wherever, the various places. I'm not going to name the places. But, South Florida has emerged as a giant in the presentation of healthcare privilege to our patients, not only in South Florida, but in the Caribbean and in South America. It seems to me that must be very exciting for you.
We have a global health department here that is reaching out to the Caribbean and Latin America and bringing those rare disease cases and those patients that need rapid whole genome sequencing and that they need genomics medicine to kind of help us guide their treatment. And Nicklaus Children's is being a door for that, and we're really proud of that. Thank you for highlighting it.
No, the reason I say that is because we are really, in particular in Florida, in South Florida, we have such a large diaspora of Cuban and Hispanic individuals, as well as really Caribbean nationals, and it's personally great. I'm grateful for venues such as yours that are there now to treat, rather than them going to Boston, New York, wherever, Texas, or wherever. It seems to me that in essence we've grown up and that's thanks to all the hard work of people like yourselves. We're down to the last minute of this show, so I want to thank Dr. Dean-Olmsted, Dr. Espinal, and Dr. Jayakar. Thank you very, very much for all your hard work. A lot of it goes, it's sort of, it's an inside job, let me put it. They know what you do, but they really never get to know you as, you know, well, look at that, Dr. So-and-so. Well, we know that we'll send somebody to the genomics program at Nicklaus Children's Hospital, but who is the Nicklaus Children's Hospital genomics program? It's you and your colleagues. So we thank you because you're the advocates for the future of care to children. And it's a blessing, really. And I thank you, all three of you and your colleagues, for doing what you do and in creating personalized and genomic medicine in the South Florida area, and particularly at Nicklaus Children's Hospital. I happened to, many years ago, meet the Nicklaus family, and I know how indebted they are to the care of children, and you're very lucky that, or fortunate, not lucky, let's say you're fortunate to have their support. So thank all three of you for showing up today. Normally we don't talk about things such as this, but the reason it came up is because there's so much interest from the public about the whole genome issue because of the pandemic. And I thought, well, you know, I knew that something was going on at the Nicklaus Children's Hospital, so somehow maybe we could slip that in and give them some information. So I hope that you enjoyed yourself. We're very, very pleased to have all three of you here. We wish you nothing but the very best. Continue to do what you do, and as I said, we thank you for being the advocates for collaborative care in areas that a lot of people didn't understand up until recent times. Thank you very much. Folks, I always tell you that, that you have to take good care of yourself. But, you know, that means you can't, if something is wrong, either with yourself, a member of your family, whether they're elderly or whether they're young, if you don't talk to your physicians, you can't go into a pharmacy or a supermarket or whatever to buy something off the shelf and try it. You're best to talk to your physicians. And I know they're busy, particularly now during the pandemic, but please take care of yourself. You know, follow the rules, follow the science, and remember, this program is called Dateline Health. We have an address and phone number right here if you want it. My name is Fred Lipman. Until next time, see you.